Dr. Rahmatu Hassan, and I am with the Partnership for Eradication of Cancer in Africa as chair of their Steering Committee. Well, first of all, cancer is a disease that most of the population of this country do not understand about, mainly because of the fact that cancer itself is not just one disease, it's a group of diseases. So it's a bit sometimes difficult to understand. But in Nigeria, you are asking of control. First of all, in order to control any disease, you need personnel, the correct doctors, the correct nurses, the correct pharmacists, and so on, in order to be able to treat that disease. But unfortunately, we do not yet have enough. Two, if you are wanting to control a disease, you must have the necessary infrastructure, and that is in the case of cancer, in form of treatment centers that can offer the kind of treatment that is required by the disease. And that is one, chemotherapy, that is the use of medication. Two, radiation, that is the use of radiotherapy, that's the use of radiation in order to treat the ailment. Now, chemotherapy requires very expensive drugs, which are not really, let's say, available for the common man. So that makes control very difficult. Next is radiation. We do not have enough radiation centers that are required in order that the disease could be controlled. Now, another thing is, and more important, is prevention. Now, because of a lack of awareness, a lot of the population do not understand what to do in order that they might be able to protect themselves so that they do not develop this disease. Because there are some forms of cancer that are preventable, like cervical cancer, cancer of the cervix. The cervix is the neck of the womb. It is found that it is preventable because there is a vaccine that already exists, which if a woman, or let's say a young girl, is given that vaccine, she will be protected from the virus that causes this kind of cancer. So there are a lot of activities going on, both in the private and public sector, regarding prevention, regarding treatment, regarding training of requisite personnel, but we are not yet there where we need to be in the country. Yeah, you see, scientists like to extrapolate regarding what obtains at a specific time. And this is what you have just read. Now, because of that, I would say yes, it's true that the way things are happening, the number of cancer cases are increasing worldwide. And unfortunately, most of this increase is happening in developing and underdeveloped countries, mainly because we have not yet been able to fine-tune our control measures due to our status of development. At the same time, because most of the modes of treatment for those that are affected are too expensive and therefore very unaffordable for a large segment of our populations in all of these countries, you tend to find that when you are counting the number of people with cancer, it will be very high because there are a lot of them that have it and they are not getting treated. To complicate the whole issue again, there is a massive lack of awareness regarding the fact that cancer is treatable through modern medicine. A lot of our communities and individuals, both affected and non-affected by cancer, believe that you can go to a prayer house and pray the disease away, or you can take some herbal concoctions and drink the disease away, which is not correct. So because of that, when our own kind of people get this disease, they keep on harboring it because they don't understand what best to do. Two, even if they want to do whatever it is that is best, it is usually unaffordable. And three, and is also usually unavailable because we do not yet have enough centers that they could be treated. Like I said in the beginning, cancer is a large group of diseases that have one name. But when you now look at the group one by one, they have different forms and names. Now, you could have cancers, for example, in the eye, that is retinal cancer. You could have cancers in the mouth, that is oropharyngeal cancers. You could have cancers in the larynx, which is laryngeal cancer. You could have cancer in the lungs, which is lung cancer. You could have cancer in the liver, which is liver cancer. You can have cancer in the uterus. You could have cancer on the skin. So, because every tissue can be affected, there is no one single yet identified mode of thing you would do that would protect you from all of these cancers that I have mentioned or that exist. But one good thing is that science has, through scientific means, it has been seen that people that have cancer, when you check, you will find that a lot of them, a large percentage of them, were smokers. So because of that, smoking is what we call now a risk factor. We tell people don't smoke so that as you go on, you don't develop cancer, because it has been seen that people who smoke, people who develop cancers usually are smokers. Two, excessive intake of alcohol. It has been seen that most of the people that have any of these cancers that I have talked about were also takers of excessive alcohol. Not all, but most of them. So when we now tell people, please, if you must take the stuff, that's alcohol, take it very little so that it will not cause whatever it is that is using to cause cancers. Because we have seen people that have cancers, when we ask them, they say, yes, we were taking a lot of alcohol before we got this disease. Three, lack of exercise. People that are sedentary, some of us, our work is, you come to work, you sit down till 5 o'clock. You now close, you are very tired. You go home, you lie down because you are tired. And before you know it, sit around in the evening and you have a meal and go to bed. And the same process repeats day in, day out. Weekends, we go to receptions or events or visit relatives and we sit down. On Sundays, those of us that go to church, we enter the church and we sit down. So all this sitting down and not doing much exercise has also been seen in patients that have cancer. When they come and say, okay, are you doing this? No, I've not been. The answer most of the time is, no, actually, because of my job or because of what I do, I don't get to do much exercise. So we now tell people, okay, please keep on exercising so that you will not develop this disease, because it has been seen that people that have this disease usually lead sedentary lives. Now, there are some infections that have been seen to cause cancers, like human papilloma virus, which has been seen to cause cancer of the cervix. And that virus, just like now you have the COVID-19, and then we have the COVID mutant, and now we are having another micron. So the same HPV also has different subtypes. And the subtype that causes cervical cancer with the same name, same kind of virus, now causes other types of cancers, but with a slight change in its structure, but the same name. And that other group of cancers are the oropharyngeal cancers, cancers of the mouth and throat, have been seen to also be caused by the HPV virus. Then people that have hepatitis B infection in the blood tend to get affected by liver disease that ultimately ends up as liver cancer. So because of that, I'm happy to say that in Nigeria we are very proud that government has introduced hepatitis B vaccination routinely for all our children, and we envisage that in the next few years we'll start to see much less liver cancer than we are seeing now from that angle, because it's also one of the, in Nigeria, after prostate cancer, liver cancer is the commonest cancer, especially in men, and it causes a lot of devastation. So up until today, many of the other cancers, scientists are still battling to understand what is it that causes them. And because of that, a lot of effort is put into prevention of those that we have now understood what is their cause. And those that we don't yet understand what is their cause, we now encourage people to exercise, not to smoke, not to drink alcohol in excessive amounts. Okay, one good thing is that it's not just through vaccination that one can prevent oneself from getting cervical cancer. A woman can also get screened for this type of cancer when she presents herself to most of the centers that conduct this screening. And a lot of NGOs put up services for screening in many clinics throughout Nigeria. And a lot of state governments also, I'm aware, have put in place services for screening for cervical cancer in most of their hospitals. And it's costing next to nothing. One another very good thing is that there is already a plan existing, a national plan for cervical cancer control that is being driven with the assistance of WHO and Bill Melinda Gates Foundation alongside other groups of international partners, whereby services for screening would be put in place, especially in primary health care centers, so that a woman can walk into a primary health care center which is close to where she lives. We all know that it's expensive to travel, both time-wise and money-wise. As women, we don't have the spare time. Unfortunately, for ourselves, we always have time for our family. So it has been thought that, okay, let there be a service for screening for this cervical cancer that is so troublesome and also very preventable, closer to the woman, so that she can be able to get the service whenever she gets the time to present herself. And one good thing is a woman needs to be screened, to be examined, that is the screening, only about once a year or once every 2 years. It's not that you should go this week and another week you must go, or next month you have to go. No, it's not like that. Because one good thing is that this cancer of the cervix is a very slow growing cancer. It develops very slowly, so it gives enough time for it to be caught. It's like you are running after a chicken that is just walking like a tortoise. You are sure that you are going to get pepper soup because you must catch the chicken. So the same thing with cervical cancer as it relates to screening. And for those of us that and then the vaccine is usually best for girls because like I said, it prevents infection from the virus, and we say that the girls should have it because this virus, you don't get it by drinking contaminated water. You don't get it by bathing with contaminated substance or soap or anything. No, it is got from sexual intercourse from the males. The males carry the virus, but they don't get infected by it. It is the women that get the infection from the men. Be active before she gets married. Let her get the vaccine so that if the prospective husband has the HPV infection already, she will be protected from getting infected and after some years getting cervical cancer. So that is why the vaccine is usually targeted for young girls.
Okay.
And screening is targeted at already grown up women, especially those that are married or those that are already sexually exposed, in order that it could be understood perchance that she might have been infected previously and she may have now getting the changes in the cervix that can be recognized as cancer of the cervix.
Okay.
Finally, I cannot answer for the federal government, because I'm not a government person. But like you and I have heard in the media, there are efforts by the authorities to incorporate HPV vaccination as part of the national immunization program, just like they have successfully done with hepatitis B vaccine. You know, before a child is born and they just get the tuberculosis, the DPT, they take their paracetamol, have their fever, and bye bye. But now, on top of that, there is hepatitis B that is also given, and there is a plan I have been made to understand to add to the whole regime of those vaccines for our children, HPV vaccination. So we are waiting, and we hope that this COVID that is dislocating everything worldwide will not make the program to also get dislocated, because you may want to understand that the vaccine is not manufactured in this country. It has to be brought from other countries where it's being manufactured. And you are aware that those other countries are also now struggling with themselves. So we pray that it will be soon. But the HPV vaccine is available. The government has allowed, NAFDAC has allowed, and you can find HPV vaccine if you are looking for in many hospitals, many government hospitals, many private hospitals make it available, but at a fee that is, let's say, is affordable to some of us.